In another story, the federal government and the World Health Organization have trained and graduated over 85 emergency healthcare providers on emergency medical services purposes. Now, the training initiated by the World Health Organization in partnership with the National Emergency Medical Service and Ambulance System is targeted at institutionalizing emergency medical services that are effective and at no cost to the patient within the first 48 hours of care. They reviewed this during the closing ceremony of 5 days training program in Abuja. Again, Benedict Uku completes the story.
With the vision to strengthen the Nigerian health system by institutionalizing emergency medical services and an ambulance system that is effective, efficient, timely, and at no cost, the World Health Organization, in partnership with the federal government, has trained and graduated over 85 emergency healthcare providers on emergency medical services response. Speaking during this closing ceremony of 5 days training program, the WHO Nigeria country representative, Dr. Walter Kazadi Mulumbo, said that the training is targeted to address mortality through emergency services.
WHO made a commitment to support Nigeria in operationalization of the Basic Healthcare Provision Fund through the National Health Act. And we were instrumental in the revision of the guidelines that paved the way to better informing the states on how to roll out the Basic Healthcare Provision Fund as part of the effort to revitalize the primary healthcare. Emergency medical services and ambulance system is one of the gateway, and which is meant to address the chronic issue of high morbidity and mortality due to emergency health conditions. And NEMSAS is an attempt to address that chronic issue, and we are happy that with our support, the government, through the Federal Ministry of Health, was able to roll out this training, which targeted the frontline workers who are engaged in a daily basis on attending to patients who have emergency healthcare needs.
Also speaking, National Programs Manager, NEMSAS, Dr. Saidu Dumbua, disclosed that the training was necessary in addressing missing link between secondary and tertiary health care delivery.
This is very apt at this material time when the Nigerian government is at top gear to roll out the National Emergency Medical Service and Ambulance System with an aim to address the missing link. The missing link in the Nigerian health sector. We're all aware that we have primary health care, we have secondary and tertiary. But we don't have what? We don't have emergency medical service. What we are doing now is building capacity. You understand? If you don't build capacity and you rush, you just crash. So what we are doing basically is to build capacity. In the FCT, those people who have actually expressed their interest to work with the NEMSAS, we have trained the ambulance service providers, the health facilities who have indicated to actually work with us. And this program that was actually concluded today, we have trained almost all the public health facilities. That's all the general hospitals we have in the FCT. We have trained them. We have one doctor, one nurse from all the hospitals we have in the FCT, ahead of the preparation to roll out that NEMSAS in the FCT. The rollout will be coming we had a little delay because of the training. So we have now concluded the training. I assure you in the next few weeks, we're going to roll out.
The National Master Lead Trainer of NEMSAS, Professor Michael Ode, also spoke about the rollout program.
This course is structured to teach people how to attend to emergencies even in very resource-poor settings. So a major component of this course is where you don't have the, state-of-the-art facilities. You can also use readily available materials to be able to provide emergency care. Emergency care is things that can kill the individual immediately. Keep him alive till you get him to a center where you can have requisite materials.
National training of trainers for basic emergency care rollouts in Nigeria saw participants from the federal capital. The goal is to train all emergency care providers to be able to provide timely, adequate, and life-saving care to all.
And away from that